It's Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I want to address a question that comes up from time to time, and that is people ask, how do I understand COVID-19 tests? There's a lot of talk about tests, but it's pretty complicated. And if you look at the literature, some of the articles are very informative, but quite complicated. So let me try to simplify it a little bit for you. Think about amount and time. So if you start at time 0, when you're exposed to SARS-CoV-2, the virus, there's a little bit of growth in the virus right there. Then it starts to grow very quickly. And if unfortunately you're one of those people that's going to get sick, then you'll start to get symptoms somewhere a week or so into the infection. Then hopefully it starts to come down. You start to show clinical improvement, and then it'll go away, in part because you get IgM, in part because you get IgG, 2 types of antibodies, and eventually the virus goes away. So what are the kind of tests that can tell us whether you've been exposed to SARS-CoV-2? Well, there's 2 types of tests. There's what we would call viral tests. So these are tests that are looking for some part of the virus. And you might hear PCR, you might hear antigen being talked about. But really what you're looking for is some evidence of the virus in your system. The other types of tests are the antibody tests. They can either be for IgM, which is the early antibody, if you will, or IgG, the late antibody, or both. So what can go wrong with viral tests? How can they be inaccurate? Well, they could be collected inappropriately. It's quite an uncomfortable test. Depending on what type of test you get, it can be uncomfortable, and it could be collected inappropriately. Additionally, it could be collected too early. There's a time before which you're going to see virus in your system, even after you've been exposed. And of course, by the same definition, there's a time in which it could be too late. You've been exposed and the viral load is low enough that it doesn't appear. And then with any test, there can be what we call a false positive or a false negative. And these are important concepts to understand. So say you have 100 people that are all negative. None of them have the disease you're testing for. But one of the tests comes back positive, a false positive, a false alarm, if you will. So this one has a false positive rate of 1 in 100. It's a very, very good test. But why is it important to know that? Because what if in your real population, you have 2 people in 100 that are actually infected, all right? So you have a 2% infection rate. Well, if you have a 1% false positive rate, then 1 out of every 3 tests you get are falsely positive. So it's always important to know how accurate a test is. What's the false positive and false negative rate? The same concepts hold true with antibody tests, right? They can be collected too early, both for IgM and IgG, or they could even be collected too late. Because what we don't know, we know that IgM wanes, but we don't really know for sure what happens to IgG. It could continue on or it could drop. And this is actually a really important concept, not just for testing, but for other purposes. Because if your antibodies drop, it may mean that you're no longer immune. But certainly you could imagine a scenario in which the amount has dropped to the point where it can't be measured. Just with the other tests, there can be false positives or false negatives. And with antibodies, at least early on, there was some concern about whether the tests were actually accurate or not. So the bottom line on testing is that testing is an essential part of controlling the pandemic. Without testing, it's impossible to tell if someone is infected or not. But tests can occasionally be inaccurate or poorly timed. So testing can't take the place of masks, social distancing, good hygiene, and so on. But testing is essential because testing leads to finding people who are infected, which leads to contact tracing. Who have they been exposed to? Which leads to new case identification. Who else is infected? Which leads to isolation and quarantine, which leads to reduced spread, which leads to control of the pandemic. So if a health worker or your health department recommends you get tested, please do so. There's lots of other information about COVID-19 on our website. Please feel free to go there and look for the videos that already exist. But if you have other questions, please feel free to contact me. I'd be happy to try to find an answer. Thank you very much.